Okay, so I've harped on about this quite a bit, about the effect of steroids and the brain. So I said, as part of the health series of videos I've just done, I would review a selection of studies on psychological impact of the brain. So now I'm going to read these because there's a lot of them. It makes it nice here. Now, way back in 1988, Pope and Katz did a cross-sectional dogs are fighting look at 41 bodybuilders and football players who had current or a history of anabolic steroid use. 22% displayed depressive symptoms, 12% displayed psychotic symptoms, and 12% developed major depression when they stopped taking anabolic steroids. A case report, a bodybuilder stated that he was addicted, could not stop taking them without experiencing severe withdrawal symptoms, including depression, disabling fatigue, nausea, and dizziness. That was 1988. 1989, Brower, a case report, said that he depended on steroids and suffered depression and aggression during use. Brower in 1990 looked at 8 weightlifters who were AAS users, and they claimed to often lament depressive symptoms. Lindstrom in 1990 looked at 53 bodybuilders and found that 51% reported mood disturbances. This could probably be anything from depression, anxiety, through to being happy, I suppose, but they were listed as mood disturbances. 1990, Perret looked at 20 weightlifters using ASS and 20 non, and did some standardized psychological testing. And the AAS users, so anabolic steroid users, had significantly more somatic, depressive, anxiety, hostility, and paranoid symptoms. And it was more so when using. They also had high levels of depression, anxiety, and hostility compared to AAS non-users across the board. However, there was no difference in major psychiatric disorders. So this would sort of say, on this evidence, that it affects mood, but doesn't cause significant psychiatric disorders. 1992, Barek looked at 12 male weightlifters and 14 male weightlifters that were past users, 12 that were current users, and 24 male weightlifters that were non-users. And they found no differences in moods, profile of mood scale, subscale scores within a questionnaire. Pope and Katz in 1994 looked at 88 weightlifters that were users and 68 that were non-users. They found that 23% users reported major mood disorders versus only 6% of non-users, whereas the users also displayed mood disorders during use, significantly more so than in the absence of steroids. So basically, their mood disorders were greater while they were using than when they were not using, but overall, the users on or off had a greater incidence of mood issues. Malone in 1995 looked at 164 weightlifters and bodybuilders that were either current users or past users and non-users. Past users are higher incidence of psychiatric diagnosis than current users and non-users. About 10% of current ASS users had hypomania. Depression occurred when ASS was stopped in about 10% of weightlifters and bodybuilders. And dependence was found in 12.9% of users and in 15.2% of past users where they claimed they were dependent. Gruber and Pope in 2000 looked at 25 female who had used and 50 females who hadn't used. 56% of users reported hypomanic symptoms during use, and 40% reported depressive symptoms during withdrawal, but none met full criteria for a hypomanic or a major disorder. Both groups reported some form of muscle dysmorphia. So it would appear that body image is more indicative of the environment than of the drug use. In 2003, Perret looked at 10 male weightlifters, users, and 18 male weightlifters that were non-users. AS users reported more effective depressive and manic symptoms than non-users. So, we're starting to get quite a strong trend here. In 2007, a case study an individual was diagnosed and hospitalized for a manic episode that was induced by AAS use. 2012, 112 male fitness amateur bodybuilders, weightlifters, and AAS dependent users, 367 male fitness amateur bodybuilders who were non-users. 15.2% of users had a major depressive disorder, while only 7.4% of non-users. So it would appear that just being involved in the sport of fitness, you have a higher likelihood of having a major depressive order. Whoa, great. So physically fit, mentally fucked. In 2013, 136 users versus 547 non-users were looked at. And 13% of users saw professional help for depression versus 5% of non-users, 13% versus 6% for anxiety, and 13% versus 4% for melancholy. And 8% of users worried about mental health versus 3% of non-users. A case study in 1989 manifested severe depression and suicidal thoughts, and there was no history of depression or suicidal tendency in both himself or his family. In 1999, 8 male athletes. A study was looked at, or a series of cases were looked at 8 male athletes, all deceased by suicide. 62.5% of suicides were committed during current AS use and 25% following 2 and 6 months of AS withdrawal. And one case, it was unclear whether he was using or not using when he committed suicide. Not so sure that tells us anything really, to be honest. So 8 guys that used gear committed suicide. Is that an action of the gear, or is there depressive state and the motivation for using the gear in the first place? In 2000, 62 male elite weightlifters suspected ASS users and 1,094 population controls. And the users had a 4.6 times higher mortality rate, which is 95%, compared to the general population. However, the main causes of death were suicide, and the second being myocardial infarction, so heart. 2000 again, 25 deceased male athletes, current AS users, so they died whilst using, and 9 deceased male athletes that were past users, and this was legal examination. 59% died by violent death, i.e. suicide or homicide. 32% was suicide and 27% were homicide. And suicide was related to impulsive aggressive behaviour characterised by violent rages, mood swings, and associated with AS use. So, to be honest, I think that one's a lot of fucking bollocks. I don't think that's so much an indication of steroid use having an impact, and more an indication of the type of person that can and does use steroids. especially when you start looking at the large percentage with homicides. 2006, 52 deceased athletes, which were steroid users, 68 deceased amphetamine or heroin users, and 309 deceased that were AS or amphetamine or heroin non-users. 44% of AS users died by violent death. Well, you know what, I'm not going to bother with that one because that's a pile of shit. 2007 case study. A user, prior history of psychotic depression, committed suicide after brief hospitalization for a manic episode during which he was diagnosed with AS-induced mood disorder with manic features. 181 male elite athletes. No significant mortality rate increase was found. However, in the age group of 40 to 50, there was a slight increase in mortality, but still very, very little. The main cause of death were cardiovascular disease or tumours, but there was a decent level of suicide. It would appear that athletes and sports people have a greater risk of suicide. Medical exams again on 24 deceased male bodybuilders, 62% used accidental drug toxicity. 1 was suicide from gunshot or hanging, and 3 from homicides. Again, I don't think that has much relevance. These do, though. Poking cats again, 41 bodybuilders, football players, and current or past AS users. And this is looking at anxiety, and 22% displayed full affective syndrome, and 5% displayed psychotic symptoms of anxiety. In 2012, 112 users, again 367 non-users. And the percentage of users with anxiety disorders was 16% against 8.4% with non-users. 2014, 67 users, 76 non-users. 12% anxiety disorder in users compared to 2.6% in non-users, which is quite a difference. 88 users, 68 non-users, 18.2% history of muscle dysmorphia versus 9% in AAS users. Now that to me would be more indicative of the drive to use, i.e. an incorrect vision of how one looks, rather than the opposite way around. And I do think it's more of a lifestyle issue when we start looking at this sort of stuff, because this was 139 bodybuilders, runners and martial artists. And bodybuilders reported the greatest AES use and had the most liberal attitudes towards use, and the main reported reason for using them was to improve looks. 35 bodybuilders that were users, 50 that were non-users. Now the users in this had significant lower levels of social physique anxiety and significantly higher upper body strength ratings and higher but not reaching statistical significance body dysfunction than non-users. So obviously they had higher body strength, goes without saying. They had a greater dissatisfaction with their physique, but it was not statistically significant. So that doesn't tell us much at all, that one, does it? 27 competitive bodybuilders versus 25 recreational male bodybuilders and 22 men with bulimia nervosa. That's a strange combination. This was in 2006. Competitive bodybuilders reported a higher level of steroid use than recreational bodybuilders. That goes without sort of saying, really. 48 male weightlifters who were current or past users and 41 that weren't. AS users showed greater symptoms of muscle dysmorphia, however many other things were pretty similar. It says differences on users on many measures, including marked symptoms of muscle dysmorphia and stronger endorsement of conventional male roles. So again, it would appear that muscle dysmorphia, body dysmorphia, an unclear view of how we appear is definitely linked quite strongly to use. The question is the insecurity in how we look the driver to use, or is using increasing and manifesting the poor body image, or probably a mix of both? Now, this in 2008 looked at weightlifters with current body image issues, 8 that had previous body image issues, and 28 that had no body image issues, and there was no real significant differences in use or abuse among the 3 groups. 20 female competitive bodybuilders and 25 female recreational weight trainers. 40% bodybuilders reported use compared to 0% of recreational weight trainers, which is fairly obvious stuff. In a survey of 550 male college athletes, 85.8% admitted to using steroids, and 14.2% were previous users. Case study on one bodybuilder that he murdered his wife after 3 months of taking AAS. It caused significant personality changes, including irritability, quarrel, and sleepiness. To be honest, I think he was probably a fucking nutter anyway. 1990, 3 male strength athlete users and 3 male strength athletes non-users. Users were tested on 4 occasions, 2 on drug periods and 2 off drug periods. Non-users were tested equivalent 4 periods. On self-rated aggression increased significantly in AAS users during their on periods, especially when using multiple AAS. 14 male bodybuilders who were current users, 13 bodybuilders past users, and 18 who were non-users as a control. Users had greater and more intense, lengthier episodes of anger, some with violence and a lack of control. There was no dose or duration responses links found. 49 male weightlifters who were current users, 94% met with criteria for dependent. Met at least 1 criteria for dependence. 57% met 3 or more criteria for dependence. And of those, 38 could be distinguished due to their larger doses, more cycles, and more aggressive symptoms. There's loads of these guys. Oh, there's not too many left, actually. So this is another study again with 1992, 12 male who were users, 14 who were past, and 24 who were non. Current and past reported changes in aggression, irritability, insomnia, muscle size, muscle strength, faster recovery from workouts, injuries, changes in libido. Current and past users and non-users showed no significant difference. 23 strength athlete users, 14 strength athletes non-users. Users reported more fights, verbal aggression, and violence towards their wives and girlfriends when using than when not using in comparison to non-users, but there's no figures there. A case report on a user, psychiatric symptoms of violent outbursts. 16 male strength athletes users, 16 male strength athletes past, and 14 non. Current users rated themselves more negatively than past users and took longer than past users and non-users to name the colours of all words set up in the Strop test. But there are no significant differences between the word sets, therefore. So this was saying that basically steroids had produced some subtle mood changes and slowed mental performance. 10 weightlifters that were users, 18 that were non-users. Users showed increased aggression. And there was some scores for personality disorders. And as I've said a few times already, you can't always rate that these drugs are having an effect on the brain. It may be the type of person that's taking the drug in the first place. Here's a study on one athlete that developed an acute schizophrenia during his use. This is 41 bodybuilders in 1988. Showing a 20% full issue with psychosis. And there's a case report of a German athlete in 2003. After 8 weeks of using nandrolones, developed anxiety and psychotic symptoms. So, of that lot, we asked the question then, what comes first? Is the mood and psychotic disorders already present in the individual and that's why they choose to use steroids in the first place? Or are the steroids having some effect on the brain? And as I've discussed in previous videos, we know these drugs have an effect on the brain. We know nandrolones particularly develop anxiety. Tren is notoriously renowned for causing anxiety. We know it can affect memory. We also know that paternal use can affect the intelligence levels of a child that's born from that parent. So I think it's quite obvious to say that yes, these drugs can affect the brain. I don't think for the average user that they're going to turn into a nutter, and I think a lot of these studies and case studies are on extreme circumstances. But having said all that, I'm not sure if this will be recorded because I just realised my microphone is 4 miles away from me. Having said all that, the research is showing an effect on brain chemistry, that's without doubt, and it is showing an effect on mood. And somewhere in the region of 60% of previous users have an increase in depressive and anxiety issues. Now, one of the problems with anxiety is that once you get it, irrespective of the trigger, it tends to be something that you're susceptible to for quite a period of time afterwards. It's not something that just goes away when you stop using these drugs. And that's something I think a lot of people don't actually realise, that use of these drugs, particularly stuff like Tren and Deca, can cause long-term issues with anxiety. And the anxiety doesn't, like I say, it stays. And then other things will trigger the anxiety that previously didn't. We're always going to have an issue of were there underlying issues before the person started using steroids, and how much of these underlying issues were the drive to using steroids in the first place. But we are looking at somewhere in the region of users at around a 25% qualifying under medical testing for having mood disorders. Now, obviously, when you look at these studies, most of them are done at quite small numbers, so it probably doesn't give a realistic overview. But from what I see from people contacting me and from the problems I work with people on a daily basis, people suffering some form of mood issues. Now, I'm not talking about them being nutters or anything like that, but you know, shut up, feeling depression, anxiety being a very, very big one, particularly when they come off, fear of losing sight, etc. And as I've previously said, I am just about to do an interview with someone who is self-proclaimed as a steroid addict. We are definitely seeing dependency forming. We are definitely seeing, well, I do think we are seeing people become addictive or addicted. I think some of this is compounded by lifestyle, and I think some of it's compounded by the environment in which we operate. You know, even in the non-visual environments like powerlifting or strongman, there's still pressure to be at a certain strength, to be able to move a certain weight, and this can definitely drive dependency and such issues forward. So, what does this mean for you? Well, it's really as simple as this. You need to look after your mental health. Now, it would appear that for most instances, dose and duration do have an impact. But, you know, if you go on Tren or you go on DECA and you start getting anxiety issues, you don't want to be posting up online, what can I take for these anxiety issues? You want to be stopping using that drug, because those anxiety issues can potentially be with you for a very long time, irrespective of whether you're using or not. And you've just got to accept that you don't get on with that drug. It's as simple as that. The amount of people and their reluctance to stop using a certain compound, even though they're suffering with quite severe side effects, is mind-boggling. The amount of people that message me with severe issues, mental issues, relationship issues, anxiety issues, depression issues, and then when I say, well, stop using that drug, it's like, well, no, can't I do something else? Can't I take something else? What if I take this? What if I take that? What if I take the other? And it's just like, what are you doing? That is the thought process of an addict. That is the thought process of someone who's dependent on that drug. You know, it's not the drug, I'm just this, I'm just that. But if I can just take this and then I can keep using it. And people are going to extreme lengths to justify continuing using a drug that is causing them some very severe side effects. Now, if there isn't something wrong there, then my beard's not red. So, we are at a position, I think, with this stuff at the moment where we are starting to open up this window, this can of worms on the effect of these drugs on our mood, on our brains. And I think 5-10 years' time, we will discover that these things can, in the right person, cause some very severe reactions, but even in your average person, can impact on mood and depression and anxiety quite easily. Now, this will always be difficult to separate because of the environments in which we operate and the pressure upon us to either look a certain way or perform at a certain level, depending on what our chosen sport is. But, without doubt, we are seeing increasing numbers of people with psychological issues. They're not going public about this, and generally they will contact me privately. And I'm not a psychiatrist, so my advice is very life-based. But, you know, it's just boggles me sometimes. If something is hurting you, then you stop doing it. And if you don't stop doing it, then I question your motivation for doing it. And I question just how independent of this drug you really are. So, if you start having anxiety issues, change your drugs. Okay, there isn't really anything out there that's going to stop the anxiety. It will mask it, it will blanket it, but it's not going to remove the issue. The issue is still going to be there. And all you're doing is setting up long-term drug dependency issues. So really you need to get to grips with that quite early. I am seeing growing numbers of people that just can't stop. They make every excuse under the sun. Some of these people are quite high-level athletes. Some of these people are people that within the sport are regarded as being knowledgeable or as being successful or as being a go-to person. And I sit on the outside looking in and think, that person's got issues. They're still using despite A, B, C, and D. So the only person that can deal with this is yourself. The only person that can face that you've got a problem is yourself. And very much like any drug addiction, until you're willing to accept that you have a problem, there will be nothing you can do about it. When you do accept you have a problem, unfortunately there is very little support available for you at the moment. I am trying to change that, but it's going to be a long process. Anyway, so a little bit different from the previous health things, but I just wanted to give you some sort of facts and figures on studies that had been done, and then finish it off with what I'm seeing personally. Now, these studies are only looking at people that class for severe issues. Obviously, what I see is a wide range of issues, a lot that wouldn't be classed as a psychiatric disorder or depressive symptom, like when it comes to medical classification. But these are people that otherwise moods have lowered and are not as good as they used to be. So, take care, guys, and look after yourselves, and I'll speak to you soon.